Quiet, please.
In my case, my symptoms came on very suddenly, very strongly.
Actress Melody Thomas Scott didn't know the cause of her sudden symptoms, but she had an idea.
I was in a car, perfectly fine 1 minute, and the next minute I was doubled over in pain, thought I had the worst bladder infection of my life, and it just happened, boom, very, very suddenly.
But it wasn't a bladder infection that had the star of the popular daytime soap opera, The Young and the Restless, doubled over in pain. It was a mysterious condition called interstitial cystitis. A condition of the bladder, interstitial cystitis, or IC, can affect anyone at any age without warning. And due to its association with the bladder, many confuse the disease with the bladder infection and oftentimes go untreated.
A lot of people think that IC is the result of an infection, or at least the symptoms are a result of an infection. And when we test their urine, these patients have sterile urine.
Symptoms can range from very mild to very severe. They include frequency of urination. The urgency to urinate increases, and as the disease progresses, severe cramping begins to develop before menses and pelvic pain during and after intercourse. Signals can begin in patients as young as 20 years of age and can slowly become worse. By eliminating bacterial infections as the cause, many urologists are now taking a closer look at urine's corrosive effect on the lining of the bladder.
When this layer breaks down, those impurities tend to attack and irritate the underlying structures. This results in stimulation of the nerves, irritation of the bladder, which causes frequency, urgency, and very often even pain of the bladder.
IC researchers have made enormous strides over the past decade in developing different treatments. Doctors may prescribe oral medications as well as a periodic intravessel treatment, a medical cocktail therapy with a pain-relieving anesthetic injected directly into the bladder by way of a thin catheter. For more severe cases, doctors may recommend a surgical procedure. Melody Thomas Scott received treatment and is now dedicated to educating others about interstitial cystitis.
Knock on wood, I have been symptom-free for a few years now. I don't want anybody else to have to suffer the way I did. It was absolute agony. So the more people that we can get out there to talk about it and spread the word, the better.